Hi, my name is Dr. Eric Liss. I'm a chiropractor and active release technique specialist. I specialize in soft tissue injuries and repetitive overuse conditions. Today I'm talking about one of the most common repetitive overuse syndromes, which is plantar fasciitis. Plantar fasciitis is characterized by a sharp stabbing pain at the bottom of the foot, usually in the heel. It's usually worse in the morning upon taking those first couple of steps out of bed and tends to get better as you stretch and walk around. The reason that is because what plantar fasciitis is, it's a chronic inflammation of the soft tissues at the bottom of the foot. What's happened is that over time, the muscles, which I'll draw here, picture this as a muscle in the bottom of the foot, which isn't actually the plantar fascia, but the muscles lying underneath, which are most usually the cause of plantar fasciitis. When you walk a certain way and you're putting too much stress on certain areas, certain tissues at the bottom of the foot, what will happen is you'll get these little tears in the fibers of the muscle. And over time, the body, what it does to repair that is it'll put this new tissue down, but this new tissue is crossed up, the fibers are crisscrossed, and the new tissue is hard and inflexible. It doesn't stretch well. Once you get a buildup of scar tissue like this and tissue that doesn't stretch well, you'll get a chronic pulling on the insertion of these muscles, which is at the heel, and then you'll get a chronic inflammation. And this will not be resolved completely until you break up the scar tissue and lengthen out these muscles that have become tight over time. And the way we do that is with something called active release technique, where we'll use motion to get in there, strip that scar tissue out, and bring the muscles and tissues of the foot back to their normal length. Once we do that, we'll go up the kinetic chain and we'll look at the tibialis anterior muscle in the shin. We'll look at the calf, the gastroconsolius muscle. We'll look at the hamstring. We'll look at the hip rotators in the butt, and we'll try to figure out why this has happened in the first place so we can permanently resolve it. Getting corticosteroid injections, getting custom-made orthotics, all of these things might help, and they might help a small percentage of the population that suffers with this condition, but you're not going to get complete results until you break down the scar tissue and lengthen out the muscles at the bottom of the foot, and then figure out why biomechanically this has happened in the first place. If you want a demonstration of active release techniques, there's a link at the bottom of this video. You can click on another active release technique doctor walking you through what a typical treatment is like. In my office, we have almost a 100% success rate with treating plantar fasciitis. It doesn't take long, it's not expensive, it's completely natural and completely safe. So go ahead and click on my website for more information or to make an appointment, and click on that link to see a demonstration of active release techniques for plantar fasciitis.